Hi, my name is Dr. Deborah Friedman. I'm a professor of neurology and neurotherapeutics and ophthalmology at the University of Texas Southwestern in Dallas, Texas. Medication overuse headache actually has a definition from the International Classification of Headache Disorders. And it states that a pre-existing headache has worsened with the use of acute medications or symptomatic medications that are taken on a specified number of days per month for at least 3 months. So for patients who are taking simple analgesics like acetaminophen or naproxen or ibuprofen, that's 15 days out of the month for at least 3 months. For patients who are taking combination medications such as Excedrin or butalbital, also known as Furoset, or opioids, then that's 10 days per month. And that is really the official definition of medication overuse headache. When you're shopping at Walmart or wherever you go shopping, things you need to watch out for: acetaminophen or Tylenol on its own can do this. Ibuprofen or Advil can do it. Naproxen, which is the most common brand name, is Aleve, generally does not. Combination drugs like the combo of acetaminophen, aspirin, and caffeine, commonly known as Excedrin or Excedrin Migraine, is actually a pretty big culprit over the counter. And of the people who are overusing over-the-counter medications, I think that that's the one we see the most of. I would recommend warning the patient that if their headaches get worse to the point where they find themselves taking acute medications more than 2 or 3 days a week, it's kind of a red flag that maybe they either need to be on prevention or that they need to have their preventive medication adjusted. It's always tricky because sometimes patients get medications from different sources, and a lot of times patients use things over the counter that we're not aware of. And for practitioners, if we solely rely on the electronic medical record to let us know what people are taking, it's often incorrect because the information in the electronic medical record is only as good as what someone puts in it, right? So if nobody asks the patient about their over-the-counter medications, and no one specifically asks the patients about how often they are actually taking their as-needed medications, then it's really easy to be misled and erroneously think that everything's just fine, right? So it's really important to ask the patient specifically, what are they taking, even over the counter? How often are they taking it? How much are they taking? So, and again, if people are multi-sourcing, if you will, then it becomes even harder, to try to control what other people are prescribing. Additionally, I just want to point out, first of all, that medication overuse is very common. And for those of us who see patients who have real frequent migraines, at least half of them are overusing symptomatic medications. And it's not because anybody's a bad person, and it's not because they were misguided. They were just trying to get relief for their headaches, or in some cases they were following their provider's instructions. Because some physicians who are not aware of medication overuse headache will actually instruct the patient to take these medications every day if they need them every day, and it gets them into trouble, but it wasn't their fault, right? The outlook overall is really excellent, okay? So I don't want to paint a gloom and doom picture for medication overuse headache. It actually, in a lot of ways, is sort of reassuring that there is a strategy that we can employ to try to make people's headaches better without blaming them for what happened. But most people who are overusing medications, and we can successfully get them off their overused medications, they do very well. And for some people, that's all they have to do. Other people, we will put them on a preventive or change their preventives, but some people, I've had plenty of people in my practice that once we talked about medication overuse headache and they stopped taking their daily over-the-counter medications, their headaches got remarkably better. So overall, the outlook is quite good.